Vecuronium is another paralytic that may be available to you pre-hospitally. I will say this is probably the least common option that we see. It has to be reconstituted and it's fairly long acting, so it's pretty comparable to rocuronium, except that rocuronium does not have to be reconstituted, so that makes it just a little bit simpler. But vecuronium takes, again, a couple minutes to take effect, but it's significantly longer acting than succinylcholine. This will keep a patient paralyzed from anywhere to an hour to 2 hours, depending on the patient. So again, this is going to be used specifically for RSI. So we're going to determine to take a patient's airway who still has intact gag reflex, who may still be breathing spontaneously. We're going to sedate them and then we're going to paralyze them to create the optimum environment for us to pass that tube, to include paralyzing their vocal cords and relaxing the muscles of their mouth and neck. Once again, super important, it has absolutely no analgesic or sedative properties whatsoever. And with these longer acting paralytics like VEC, we have to be super on top of our sedation and analgesia, because if we paralyzed and sedated a patient that had any level of consciousness beforehand, which is not always obvious to us, by the way, and if we do not provide appropriate analgesia and sedation, they will be paralyzed and aware of what's going on around them. So we have to be really aggressive with those things during the paralysis period. We can't rely on things like tachycardia, blood pressure, and tearing to tell us that the patient needs more sedation. While those things may certainly be present, they are not always. So we just need to err on the side of caution. So your dosing for this is a bit lower than the others, 0.15 mg per kg. Again, it needs to be reconstituted. I believe it says in your pharmacology manual that it can be used for like agitation with intubation. Be really careful with that, because usually if a patient is intubated and they are in any way, shape, or form agitated or overbreathing the ventilator or your BVM, the answer is sedation. They need more sedation. Very, very rarely is the paralytic the answer. So in rare circumstances that may be the case, but make sure that the patient is adequately sedated and that their pain is controlled before we are redosing a paralytic.